In 2010, the Hampton University Proton Therapy Institute opened its doors. Over the last 9 years, more than 2,500 patients have been served. Here to tell us more about the Institute and its process, Dr. Allan Thornton, a radiation oncologist. Dr. Thornton, thanks so much for talking to us more about what's happening here. And first, let's talk about why it was opened back in 2010 in this location.
Well, Dr. William R. Harvey had the inspiration from his alumni, I understand, to bring proton therapy to this region based on the excellent results that graduates of Hampton University had out in California and up in the Northeast.
So here now in 2019, people still have questions about proton therapy. And I know you have a really great example that you can share with us.
Cheryl, you and I are actually 68% water.
Okay. And
water has electrons in it, and electrons are negatively charged. And so this machine that was invented at Harvard back in 1936 takes hydrogen gas and makes protons from the hydrogen gas. The hydrogen gas, the proton from the hydrogen gas, is then accelerated through your body and can be controlled very precisely and stopped within 1 millimeter of precision where we want to locate it.
Wow.
So this lucite that is on the table just happens to have the same density of electrons that you and I do. And we irradiated this plastic and discolored the plastic so that you can see the beam. And it comes in from this direction, passes through the plastic, and as it passed through the plastic, it ran out of energy and stopped right here. And so this is the only form of radiation that you can actually stop. And we controlled it to stop right at this point. And that's what distinguishes it from all other forms of radiation therapy. We can control it, and we can treat so much less normal tissue.
In terms of patients, what does this mean for someone who has cancer? What types of cancer can be treated, and how will they get the benefit of this type of treatment?
What this means is that the patient's solid tumor, this is not appropriate for leukemias, but most other solid tumors we can treat with proton therapy. To take it down for my children, it means that I treat very much less of their brain for treatment. It means that they have less IQ changes with growth, less developmental delays. For my adults, well, for prostate gentlemen, it means a lower risk of damage to the rectum. For my lung cancer patients, it oftentimes means that I can treat them without the use of surgery. For my women with breast cancer, it means that I can treat the left breast and not give any radiation to the heart, which is of critical importance to younger women especially, who are receiving both chemotherapy and radiation therapy. So each disease site and each anatomic site has its advantages with proton therapy.
If people have questions about the Proton Therapy Institute, where should they go?
Oh, please go to hamptonproton.org, or they can call 757-251-6800.
Dr. Thornton, thank you.
Thank you very much, sir.